HIV/AIDS is by no means a new disease in the United States. According to the CDC website, it is dated back to the 1970s. There are currently 1.1 million people living with the disease in the U.S. and about 36,000 new incidents each year. My Pecha Kucha analyzes how the healthcare system creates inequality and stigma among individuals living with HIV. Through researching various studies, I have found that minority groups are greatly affected by the disparities in the healthcare system. Government action has been limited since the beginning of the disease, and resources for those with a lower socioeconomic status are often from community interventions. But what exactly is HIV? According to the CDC, HIV is the weakening of the immune system's ability to fight off infections. There are 3 different stages. The last and most severe, with only a 3-year survival rate, is AIDS. Once at the 3rd stage, living a comfortable life is extremely difficult. Although no cure exists, the disease can be controlled with preventative measures and treatment, such as the antiretroviral therapy. But there are existing societal and economical disparities limiting access to treatment. The CDC website states that the average cost for a lifetime of HIV treatment is $38,000, an amount that someone with limited or no insurance can't afford. Transmission of the disease can be through male-to-male sexual contact, drug injections, and heterosexual contact. According to the Kaiser Family Foundation, 256,000 women in 2016 were living with HIV, so it is not limited to men. Mothers can pass on HIV to their baby in childbirth or during the breastfeeding period. Although HIV can be transmitted to anyone, your family, friends, neighbors, it's rarely talked about due to the stigma that society has placed. Individuals that have tested positive often stay silent, which leads to feeling ostracized due to the fear of possible repercussions if their status is disclosed to others. According to Rubin, Collin, and Link, it is considered a disease of the marginalized population, based on race and ethnicity, sexual orientation, and those of a lower socioeconomic status. Rubin et al.'s study in 2005 found that disadvantaged and racial minorities are at greater risk of dying from the disease. With an age-adjusted analysis in 2011, they found that HIV/AIDS mortality rates per 100,000 individuals was 782% greater for Blacks than whites. The Kaiser Family Foundation reports over 47,000 of the 1.1 million living with the disease in 2016 to be Black. According to the CDC, 70% of the transmission in 2014 was due to male-to-male sexual contact, with the largest pool being Black male-to-male sexual contact, followed by Hispanic and Latinos, mixed races, Asians, and whites. Transmission from male-to-male sexual contact was 8 times that of heterosexual contact. But this was not always the case. In researching the epidemiology of the disease in the U.S., Richard D. Moore states that in the 80s, the disease used to primarily affect middle-class white men that engaged in male-to-male sexual contact. But since these middle-class individuals have access to higher quality health care and race is not an issue for them, a change in rates occurred. A switch occurred after the 80s, increasing the demographic diversity of incidence of HIV and an increasing incidence for minorities. According to Dombrowski, Simoni, Katz, and Golden, the unstructured, unequal healthcare system in the U.S. leads to the disparities between individuals living in different regions of the country and also in their knowledge on preventative measures offered in communities. A prime example of this disparity among geographical regions is the incidence in the South. According to Reif, Whedon, Wilson, McAllister, Pence, Legren, and Gond, 49% of the disease incidence in 2011 in the U.S. was in the South. Out of the 10 states with the highest prevalence, 7 of them were in the South. Well, why is this the case? The South has high rates of STIs, high poverty, and a lack of access to quality healthcare in most areas. The root systemic issues in the region contribute to the high incidence in the South, but yet they are not addressed because the population's needs are often ignored, as Reif et al. States. Stigma around HIV/AIDS in the South has intensified because a majority of their population is African American, Hispanic, or Latino, and there's a higher likelihood that these racial groups believe homosexuality is wrong. In 2010, Reif et al. Reports 64% of minorities believe this, while 48% of whites have that belief. Government action on the epidemic has been uncertain since the beginning. According to Perez and Dionysopoulos, in the 80s, when the epidemic first began to get public attention, the population thought that the government would intervene in an attempt to slow the progression of the epidemic. Instead, the Reagan administration publicly joked about the disease and referred to it as the gay plague, which intensified the social stigma of the disease. And although methods of governmental action have changed since then, the social factors and influencing judgment surrounding the disease continue. As Padamsey states in his argument, the U.S. does not take into account scientific evidence when needed to implement policies, but instead tries to avoid backlash for their decision. Policy is primarily influenced by moral concerns rather than evidence, leading to limited success of interventions. In order to target the issue, conclusions in the Rubin et al. Study found that the success of interventions in all populations relies on a focus in the social and environmental factors of the individual communities, which would aid in the implementation of policies that are equitable. Community-based efforts focus on education, resources, testing, and support in an effort to reduce the inequalities that our healthcare system brings about in regards to the disease. Individuals living with the disease are also a force of change as they march and protest to receive the support they deserve. It is clear that HIV/AIDS is going to continue being a social issue in the U.S. for the years to come. In order to support individuals living with the disease, change needs to occur to decrease stigma and increase access to quality health care for the disadvantaged and marginalized population.